surgery, feel free to shoot them our way, and I will get to them when we wrap this up. But we're going to go over some common questions that we normally get. So what is the ideal timing for scheduling my plastic surgery? So a lot really goes into this. One is you want to schedule it around a time when you're going to have plenty of time to recover comfortably and that you're not forcing anything. You also want to consider if you're trying to get this in before a special event for your wedding, one of your children's weddings, anything like that, or just before your summer vacation to get that beach body you've always wanted. You want to plan with plenty of time ahead so you have plenty of time to recover, so you're seeing the results that you want to see by the time you have that special event planned. You also want to really think about it. If you have any medical problems at all, you want to start the process early. We have a very thorough pre-operative approval system in place so that we're making sure we're doing everything as safely as possible. So anyone with medical problems, pre-existing medical problems, we're going to get additional clearances, sometimes by a cardiologist or a pulmonologist or an endocrinologist. And we want to make sure we're addressing those things very early on so that there's no surprises when it comes time to schedule a surgery date and get things moving along, and there's no last minute things that come up preventing us from moving forward with surgery. So those are things to be thinking about. So this is really something, if you're considering it, you need to start the process early, ideally a few months beforehand. We also have limitations in our schedule. Sometimes we have some last minute openings, but usually we're booking a few months out. So you really want to start this process as early as possible. So how should you prepare for your surgery? Again, this kind of goes back to optimizing safety. We want to optimize your health, your baseline health as much as possible. If you have any issues like high blood pressure or anything like that, you want to be working with your primary care doctor to get that well controlled with a medication regimen that you understand well. And if you're getting some of these procedures where we have BMI requirements and you're close to those cutoffs, you want to really try to lose weight as much as possible. And we always recommend getting to your ideal body weight where you're going to be stable at for a while is what we really want to achieve. So if that involves losing some weight, you want to focus on doing that before scheduling your plastic surgery. So are there specific vitamins or supplements I should avoid before surgery? Yes, there are. And this is, again, part of our very rigorous pre-op process. We'll go over all of this with you, but certain things can cause increased bleeding. And so some of that may be vitamin E or omega fatty acids, and just avoiding NSAIDs or Advil, Tylenol, not Tylenol, but Advil and ibuprofen. So those are things that we're going to talk about before surgery. Some of the weight loss drugs you need to stop beforehand. These semaglutide medications decrease gastric emptying. So at least about 3 weeks before surgery, we need to stop those medications to make sure it's safe to proceed with anesthesia. So what is the expected recovery time for different procedures? So this is a great question, and obviously something we'll be going over at the time of your consultation to discuss different recoveries for different procedures. But for the vast majority of our procedures, I always tell people, if you work a desk type job, you want to take at least 2 weeks off from work to give yourself time to recover. Some recoveries are a little easier than others. Most breast procedures are pretty well tolerated and people are getting back to their normal routine pretty quickly. Things like tummy tucks, where we're tightening up the abdominal muscles, or BBLs, where you're getting a lipo 360 and you have to stay off your butt. The recovery may be a little bit more involved and may require a little additional time that you want to plan for. When can I resume normal activities after surgery? So again, kind of like I was saying, for most of our procedures that we do, 2 weeks after surgery, you're getting back to most of your activities of daily living without any issues. There will be some limitations on how much you can lift or certain exercises you can do in the gym, avoiding abdominal exercises and stuff if you had a tummy tuck for at least 10 weeks after surgery, giving us time for you to kind of heal in your muscle repair that we did for you. But most normal activities at 2 weeks, and then by 10 weeks, basically all restrictions are lifted for all procedures and you're back to doing whatever you want. How can I manage post-operative pain? So this is a great question, and this is something we're always striving to see what we can do to decrease postoperative pain and also to limit the use of narcotics. Obviously, narcotics aren't great for a multitude of reasons, and they're necessary for some surgeries for a period of time afterwards, but we've been coming up more and more protocols to decrease our need for them both in the operation itself and the post-op recovery period. So some of the things we do to really help with that is we give Exparel medication, which is a long-acting local medication for certain procedures like tummy tucks. And then it's just really scheduling your pain medicine regimen afterwards. We embrace starting Tylenol early and then ibuprofen within 2 days after surgery, even though it has a slight risk for bleeding, where you feel safe doing starting on day 2 after surgery. This really helps you manage your postoperative pain while limiting the need for using narcotics. I also give muscle relaxers for a lot of my different procedures, especially for any implants that are going underneath the muscle or for any muscle repair. And those muscle relaxers tend to help a lot with the discomfort, again, limiting the need for narcotics. What considerations are there for post-pregnancy aesthetic procedures? So this is a great question. And so for the most part, if you just recently had a pregnancy, you need to give your body some time to recover. It just went through a huge event. You depleted some of your own resources, your vitamins, different things by creating another human being. So you need to give your body a chance to recover, to get all of its levels normalized, and then also just things like your abdominal wall. It needs a chance to recoil and get to its most baseline state before we go in and do stuff. And then with breastfeeding, you want to wait. So after pregnancy, if we're talking about doing a tummy tuck or something, I say you need to wait at least a year after a pregnancy to move forward with something like a tummy tuck. When it comes to doing any breast procedure, you need to wait a minimum of 6 months after you've stopped breastfeeding and producing milk. Because if we operate too soon and you're producing milk, it's possible to have complications where you can develop a milk cyst actually. What considerations are there? How long after surgery will it take to see final results? So this is a great question that we get all the time, and this is a really important thing to think about before surgery because you're not going to see final results immediately. For breast procedures, we need a time for the implants to settle and for your natural breast tissues to settle. So usually at the 3-month mark, you're seeing great results and you're close to your final results, but the results still can continue to mature for up to a year for just about anything that we do. So either that's a liposuction and BBL or a tummy tuck. For the tummy tucks, I always say you can still have some swelling in your lower abdomen for up to a year while all those lymphatic channels that we cut through are healing. And then at that 1 year mark, basically no more swelling, no more edema, and you should be at your final result. Scars continue to mature for up to 2 years after making an incision, and so the pigmentation related to the scars will continue to improve for up to 2 years. So it's just good to keep that in mind that things are continuing to improve for quite a while afterwards, even though you're seeing the majority of your results at the first 3 months. Is it safe to combine multiple procedures in one surgery? Yes, it definitely is, and we do this all the time. The important things to keep in mind are the total amount of time that you're getting anesthesia, so we're not going for a super long surgery. We're able to do quite a few things during the limited amount of time. We like to keep things under 5 hours, so whatever thing we think we can safely do under 5 hours is what we will recommend. And then you also want to make sure that those procedures go together. So you want to do things like breast and tummy procedures go together nicely. Liposuction and fat grafting obviously go together, but doing a tummy tuck and a BBL, in my opinion, does not go together because of the recovery of those two different procedures. For the BBL, you need to stay off of your butt, and for a tummy tuck, you're laying on your back for a few weeks when you're recovering for that. Those procedures just don't go together in my mind. What should I know about the scarring process after surgery? Kind of like what we just touched on. Your scars are going to be there for the first year, and they're going to continue to improve. The things we can do to improve scarring the most is by using some type of silicone product, so either silicone gel or silicone strips. And then the second thing is avoiding UV exposure or exposure to sunlight to decrease the pigmentation of those scars. And that's the big stuff I have from the questions we were going to go over today, but do we have any questions from the audience right now?
Yes, we have one. Good at work garments for tummy tuck after scar massage.
Uh, yeah, so compression garments are always good after a tummy tuck or a liposuction procedure for at least those first 3 months after surgery. And compression actually does help with scarring too. It's hard to get the really good compression. That's something we use in different fields of plastic surgery for burn surgery and stuff. If you get a scar on your hand, you wear special compression gloves, and that does help with scarring.
Okay. Another one, if you have implants over the muscle already, could you do over the muscle again or can you go under for the second procedure?
You can do both, and depending on the circumstance, I often keep the same pocket that the implants were originally in, as long as there's no issues like a capsular contracture. But if there are some issues like a capsular contracture, or we're going to be replacing the implants and also doing a lift at the same time, then sometimes I recommend making a new pocket underneath the muscle. So it depends on the individual's circumstance.
Okay, TikTok's on fire, Doc. There's a lot of
Alright.
people for real. Um, this one says, how can you tell if someone has diastasis recti?
So yeah, this is based off of an examination we can do in the office. I can oftentimes just tell by how you're standing and looking at how much tissue you have above the muscle by pinching that. But the way to really tell is by having you lay down on a table and attempt to do a sit-up. And you can almost see the bulge right in the center of your abdomen is a good way to tell someone at home even if you want to look for yourself to see if you have diastasis.
Is Galaflex a must?
Galaflex is not a must. A great option for people who've had issues with, so what is Galaflex? Galaflex is the temporary mesh that we use and also called the internal bra that we use for breast procedures. And it is a great adjunct for people who've had issues with their implants dropping or drooping or their breasts just in general after doing it. I don't typically do it as a primary thing if you've never had an issue with those things. But if you've had issues with the implants continuing to drop, then it's a great option that it's a great tool for us to use.
And then are several questions about pricing on costs, life
Yeah.
costs, tummy
So-
tuck costs.
So go to pureplasticsurgery.com and you can start the consultation process and we'll get you information on pricing right away. It's individual for each different person because we have a perfectly tailored plan for you. And so we don't just have generic pricing for any individual procedure, okay? All right, everybody, have a great day, and I will see you next week for next week's Thursday Thoughts.
And where are you guys located? This is important.
We are Pure Plastic Surgery here in Miami, Florida. I'm Dr. Garrett Wiegriff. I am a double board certified plastic and reconstructive surgeon. Please come check us out at pureplasticsurgery.com.
Yeah.